Good morning. My name is Anita Furku. Today I'm going to talk about assertive communication. In my presentation, I will explain that assertive communication means its strength and its limitation and how it's used in health and social care. I will also explain how assertive communication help social care workers provide person-centered. What is assertive communication? Assertive communication means being able to speak calmly and politely. It means sharing your thoughts, feelings, and ideas in a honest way while also respecting other people. Assertive communication is about finding the right balance. It's not being aggressive, it's not being passive. An aggressive person may speak in a rude or angry way, may not listen to others. A passive person may not share their feelings or opinions because they are worried about upsetting someone. An assertive person can explain what they think and feel while still how show respect. In health and social care, assertive communication is very important because professionals work with many different people every day. Patients, service users, families, and other staff members all need good communication to work together. Why is assertive communication important in health and social care? Healthcare workers need to communicate clearly because people's health and safety can depend on it. For example, a nurse needs explain medication instructions clearly so the patient understands how and when to take their medicine. If the information is not clear, it could cause mistakes. Assertive communication helps patients feel safe, listened to, and respected. When healthcare workers speak calmly and listen carefully, patients are more likely to trust them. It also helps building a good relationship between healthcare workers and patients. This is called a therapeutic relationship, where the patients feel comfortable sharing their concerns and feelings. Strength or assertive communication. There are many benefits of using assertive communications. First, it improves understanding. When people communicate clearly, there is less chance of confusion or mistakes. Second, it helps solve problems. If a healthcare worker notices something is wrong, one can speak up respectfully, weigh and help find solutions. Third, it supports teamwork. In health and social care, professionals often work together, such as nurses, doctors, carers, and support workers. Good communication helps everyone understand their responsibilities. Other strength is that it supports patient choice. Person-centered care means treating each person an individual and involving them in decisions about their care. Assertive communication allows patients to ask questions, share their wishes, and make informed choices. For example, if a patient don't understand their treatment, they should feel comfortable saying, "Can you explain that again?" A healthcare workers should respond kindly and prove more information. Limitation of assertive communication. Although assertive communication is very useful, there can be some challenges. Sometimes people may find it difficult to be assertive because they lack confidence or they are worried about that others will think. Some patients may have communication difficulties because of their age, language, disabilities, or health condition. Healthcare workers need to adapt their communication style to meet the person's needs. For example, someone with hearing difficulties may need information written down, and someone who speaks other language may need extra support. Other limitation is that assertive communication takes practice. Not everyone learns these skills immediately. Healthcare workers need training and experience to become confident communicators. Assertive communications is person-centered care. Person-centered care means focus on needs, feelings, and choices of the individual. Assertive communications support needs-centered care because it helps health workers understand each other person better. Every patient is different. They have different background, cultures, beliefs, and experience. Healthcare workers should respect these differences and communicate in a way that makes each person feel valued. For example, if a patient is worried about procedure, healthcare workers should listen to their concern, answer their question, and explain what will happen. They should not ignore the patient's feelings. By using assertive communication, healthcare workers can support patients to feel involved and respected. Example of assertive communication. An example, assertive communication is when healthcare workers says, "I understand you're worried. Let me explain what will happen and answer your questions." This is show kindness, respect, and clear communications. Other example is when staff member needs to raise a concern. Instead saying something in angry way, they can say, "I am concerned about this situation. Can we talk about how we can improve it?" This keeps communication respectful and helps solve problems. How healthcare workers can improve assertive communication. Healthcare workers can improve these skills by practicing active listening, staying calm, and thinking before speaking. They should use friendly tone in voice, meaning respectful body language, and give people time to express themselves. It is also important to remember what communication is not only about speaking. Listening is just as important. A good healthcare workers listen carefully and show that they understand the person's feelings and needs. Conclusion. In conclusion, assertive communication is an important skill for everyone working in health and social care. It helps healthcare workers communicate clearly, building trust, support teamwork, and provide safer care. It allows patients to feel respected, listened to, and involved in decisions about their own care. Not every person communicates in the same way, so healthcare workers must consider the person's age, culture, language, and health needs. Developing good communication skills can make big difference in the quality of care people receive. It will continue to improve my assertive communication skills during my studies in my future career. Thank you for listening.